Hello and welcome to Health Matters on Channels Television. Thanks for staying with us. I am Mary Alale Yusuf. We have heard of hypertension, a very common silent killer, but perhaps pulmonary hypertension is a foreign term to many. Who knew there could be subtypes? Pulmonary hypertension is high blood pressure in the arteries of the lungs. How the disease starts is not always clear, but the arteries become narrow and there is less room for blood to flow. Not unlike regular hypertension, less blood flow means harder work for the heart. There are more cases among women than men, and it typically affects people between the ages of 20 and 60. Joining us in the studio is a doctor in internal medicine with subspecialty in pulmonology from the Lagos State University Teaching Hospital, LASUTH, Dr. Olarunke Folarunmi Adeoti. Also with us is a lady who is living with pulmonary hypertension, Ayotunde Omitogun. You are welcome to the show.
Thank you. It's great to be here.
Pulmonary hypertension is not something, or should I say something I learned about in the very recent past. Not a term I'm used to. And with the way hypertension is, nobody wants to hear about any other type. But anyway, let me start with you, doctor. Do people with pulmonary hypertension also have regular hypertension? Do they come together?
Okay, so people that have, because pulmonary hypertension has a couple of causes, so it can be a complication of a heart condition. So people that have heart failure can come down with a pulmonary hypertension. So
but can someone with pulmonary hypertension be free of the regular one?
So you can't say never.
Yes.
Yeah. But because there are other heart conditions that can affect the left side of the heart that can lead to pulmonary hypertension.
Okay. So can I ask what causes pulmonary hypertension?
Okay, thank you. So for the causes of pulmonary hypertension, there are a couple of causes, and that's why pulmonary hypertension has been grouped into 5 groups. So I'll just run through the causes. I'm not going to go into the details of each group. So for pulmonary hypertension, it can actually just be that there's increased pressure in the pulmonary artery. It can be because of some medications, can be because of drugs like cocaine, amphetamine can be a cause of pulmonary hypertension. Then it can also be because there's a condition that is affecting the heart. So if there's a condition that's affecting the heart, like maybe people that have rheumatic heart diseases, people that have heart failure, it can also lead to pulmonary hypertension.
So pulmonary hypertension could be a secondary disease caused by something else that was there before.
So people that have lung issues can also have pulmonary hypertension. Maybe someone that has an interstitial lung disease, someone that's had tuberculosis. People that have clots in their lungs can also come down with pulmonary hypertension. And then also people that have there's some other causes. Then, like I said, can also be idiopathic. Then people that live with...
idiopathic meaning you don't know the cause.
Don't know what's causing it. Then people that have sickle cell anemia can also have pulmonary hypertension as a complication of that condition.
Because obviously blood flow is an issue with people who have sickle cell disease.
So because of the repeated anemia that they have, there can be complications. And then because of the crisis, the vaso-occlusive crisis also.
Okay, so let me also go ahead to ask you what the symptoms are.
Okay, so the symptoms for pulmonary hypertension are not just peculiar to pulmonary hypertension alone. So this is one of the reasons why, like you said, looks like people don't really know about it because it can be mistaken for something else. So someone with a pulmonary hypertension can come down with breathlessness that is usually associated with exercise, but though it can progress and then can even be breathless even at rest. They can have chest pain, they can have fainting or near fainting attacks, they can have swollen legs, swollen abdomen, they can also
swollen legs.
Yes.
People will be thinking of kidneys.
Yes, they can think that they have kidney issues.
All right. So Ayotunde, let me ask you, how did you discover your condition? What happened? What were your symptoms?
Okay, I was
diagnosed with congenital heart defect known as hole in the heart after some years. After I was born, and unfortunately, it wasn't treated. It wasn't closed. So I lived with it. I lived a normal, okay life. I was a bit small for my age. I was really small, but I was a bit active and I was young. I could do a lot of things. Then I got older, to my early 20s. I realized my symptoms were getting worse. I used to make clothes then. I used to sew. So I realized I get tired, fatigue more easily, shortness of breath. When I take these stairs, I have to pant a lot. Then I have more palpitations. So at that time, I was thinking, that, oh, why can't I just close this hole? So I went to the hospital and I was expecting to hear, okay, let's think of a way of closing this hole. And I was
okay,
told,
you thought it was the hole.
Yeah, I thought it was the hole. I always knew I had the hole, but wasn't treated because for some reason, I think there was a very little information about the complications of congenital heart defect. So maybe my parents didn't know how serious it is if the hole is not treated.
Okay.
So when I was in my 20s, I went to the hospital and I wanted to find a way to close this hole. And unfortunately, I was told I had pulmonary hypertension. I was like, what's that? I was a bit surprised. I was that because I've heard of hypertension. So I was a bit shocked. And yeah, that's how it started. I was told that was already too late. The pressure was too high and the hole can be closed again. I just had to manage the pulmonary hypertension with medications. We checked some other options. I also went to India for second opinion. I was thinking that maybe I'll be able to close the hole there.
But second opinion is good.
Yeah, it's very, very important. And I was also told that the same thing, manage it. You can't close the hole again. So yeah, I'll be doing that. That was about 10 years ago, and I'll be doing that since
10 years on?
Yeah.
Okay, so since you've been managing it, are there things you are unable to do?
Yes,
does it prevent you from doing something?
Yeah. The problem with hypertension is highly progressive. That's why it's good to get diagnosed early and be on treatment early. And when I was actually diagnosed, it was very difficult getting treatment. I was placed on some drugs, and then when I went to India, I used to get it from India. It wasn't available in Nigeria at all that period. So yeah, it was really getting treatment. I couldn't do a lot of things, and I realized that with time, it progresses. At the particular time, I had to even stop working. Like at first, I get fatigue and maybe shortness of breath when I exert, maybe do something stressful. Then later I started noticing that even just sitting down, doing very little activities like sweeping, then it gets worse. So yeah, it's progressed with time. Yeah, but I think I was having issue getting my medication because I was getting them from India. So I was on and off medication. Okay. So I fall sick a lot. I have a lot of flares. I had to go to the hospital. Sometimes I had to be on oxygen because your oxygen level goes so low. But fortunately,
but now are you regular?
I'm more regular on my treatment. I got treatment. I got now treatment is not available in Nigeria, not a lot, but we don't have a lot of options though, but a particular treatment is not available. So yeah, I'm more regular on treatments than like before. So I'm a bit more stable. Doesn't mean that I can do a lot. But a bit more stable. And I realized that since I've been more regular on treatment, my pulmonary pressure dropped a bit. Yes.
But are you still able to do, the normal walking, maybe carrying of heavy objects, walking up the stairs?
Yeah, I can do more now since I've been more stable in managing my condition, but I can still do a lot. Like taking stairs, but when I took the stairs, I was short.
You were panting?
Yeah, I was panting.
Okay.
Yeah, like I still don't do a lot of household chores like sweep. I don't really like to bend too much. I don't carry anything too heavy. Yeah, but I can do more, but it still limits me. I can't even walk because...
But I can tell it's not affecting your brain. So that one is moving really good.
Funny, in a way. It's something called brain fog. I have brain fog. I think maybe when the oxygen level really is very low. Yeah, when I'm really fatigued, like, I can't concentrate, I can't think. I just have to be in that rest and just because I send messages and I make mistakes. Even when I'm talking, it affects my speech. Yeah, so the way it affects.
Doctor, I want to ask you something. Okay. That hole in the heart, if it had been closed early, would we be talking about pulmonary hypertension in Ayotunde?
Okay, ma'am. So if it had been closed earlier, most likely we wouldn't have been talking about pulmonary hypertension because as a result of the stress on the heart, there's a reversal of flow of the blood in the heart, and then that put more pressure on the lungs, the pulmonary circulation. That's the vessels that carry blood into the lungs, and most likely that's what caused
the
pulmonary
progression
hypertension.
onto pulmonary hypertension.
So because in children, there's something called children can have pulmonary hypertension.
Why?
There's persistent pulmonary hypertension of newborn. If you have a newborn with congenital heart disease that's not closed early, they can't.
But the newborn is not moving anywhere.
Yes,
He's not exerting himself.
So because the heart is a pump and then has a way it should flow.
But that must be really bad for it to be
pressure,
affecting a baby.
Yes.
And assuming there's a newborn now, can you quickly detect such a problem?
Yeah, so for children that are born with congenital heart disease, when they discover and then something is done early, yes.
Okay, so earlier on, Ayotunde was talking about not being able to easily get medication for the condition. Does that mean that the medication for hypertension is different from the medication for pulmonary hypertension?
Okay, yes, ma'am. So sometimes someone that have hypertension can have some similarities of drugs with someone that has a pulmonary hypertension based on the course of the person's pulmonary hypertension. However, there are some other drugs that are particular for pulmonary hypertension because those drugs have been designed in a way to affect the mechanism of the pulmonary hypertension.
So they're more targeted towards the lungs?
Yes.
Okay.
Kind of. So, but then there can still be some other similarity because if someone has a heart failure and is on heart failure regimen, because part of how to tackle this pulmonary hypertension, you must treat the cause for someone that you know that this is the cause of this pulmonary hypertension.
Which means, in her case, a hole in the heart.
Yeah.
Okay.
So they have to treat as symptoms of the hole in the heart also.
Okay. Are there ever any options of transplant?
Yes, it's an option, but you know, lung transplant is not something that is readily available.
Nothing is readily available. I mean, when it comes to transplants,
yes.
not only in Nigeria, but everywhere in the world, it's hard enough to get a kidney, but lungs. Yeah. I've not actually even heard of a lung transplant.
But I think it was a patient last suit, like 2 years ago. It was a teenager. He needed he had end-stage pulmonary hypertension and heart failure. He needed a heart and lung transplant. Unfortunately, he died. They were trying to raise money for him to go to India to get it done. Okay. Unfortunately, he died.
Can't it be done here?
Not yet.
It can?
Not yet.
Not yet. Okay. We're getting somewhere. This looks like such a new, sort of new field in Nigeria. At least it's not a new condition, but maybe we're still searching, we're still finding pathways in Nigeria.
I think it's just awareness that is getting more.
Okay. All right. Would you say you lead a reasonably normal life now?
Sorry, I don't think I'll say so.
You don't think you'll say so?
Yeah.
Do you work?
No, I work. I run a campaign called USABPH, an organization called community.
And it's all about pulmonary
hypertension. But you have to remotely, because it's not easy to do a lot of stressful things like go out every morning, come back. Yeah. So yeah, but I used to make clothes before. Like I said, I had to stop. So I don't really work. Even
okay, you spoke about oxygen to the brain. Do you sometimes have to take oxygen?
Yeah, because pulmonary hypertension, your pressure, your blood oxygen level drops. So normally my oxygen level goes between 88 to 92.
Oh, you even know? Do you keep that thing on your thumb all the time?
Yes.
So you check it yourself?
Yeah, all the time.
And then, okay, let's say you see that the oxygen level is low.
No, for me, if it's below 85, like 88, 92, I can still manage, but some other people can manage, but me, I can still manage. By the time it goes below 85, I need oxygen.
Do you have to give her the oxygen, or can she take it herself?
So there are people that will have to go on long-term oxygen therapy because of the complication of pulmonary hypertension. So one of the symptoms that I forgot to talk about is that they can notice discoloration of their lips or their fingers. The lips might be dark colored, the fingers might be like bluish colored. So there are some that because they persistently do not have enough oxygen supply to their system because of the progression of the disease. They might have to go on long-term oxygen therapy, and for this kind of patients, they have to have the oxygen with them at home.
Okay, we need to go on a break. When we come back, we just continue with this. Please stay with us. We're going on a short break. Please meet us on the other side. Welcome back. It's Health Matters on Channels Television, and we are discussing pulmonary hypertension. If you have questions on this topic, you can call 0808 054 2233. It should be showing on the screen now. You can also send a message at CTV_Mary A and send me email to moalale@channelstv.com. The topic is pulmonary hypertension. Doctor, let's say you have a reasonably healthy human being. What kind of habits must the person not get into to have a better chance of not coming up with pulmonary hypertension?
Okay, so because of the vast causes of pulmonary hypertension, some of which you might actually not be able to prevent, but there are some things like use of alcohol, smoking, so that you don't come down chronic obstructive pulmonary disease. Use of substances like cocaine. Cocaine has been implicated. Cocaine, amphetamine, those have been implicated. And then for people that have conditions that can actually progress to a pulmonary hypertension, it's good you are being followed up by a specialist, so that at least let the primary condition be well managed. But then,
so if your child isn't breathing well, please take him to the hospital.
Not just a child, anybody that is not breathing well. And
anybody.
You have tried, you've been managed by somebody or somewhere, and you see that management that you're being given, treatment you're being given, is not alleviating your symptoms. I think you should go further and see a specialist.
You know, people have said that exercise is good for everything. It does so much. It makes you, think sharper. It makes your blood flow better. You're healthier. You're not obese. So many things. How do you factor exercise with somebody who has this condition? Or do you just tell the person, no exercise for you, go home?
No, so for somebody that has this condition, in as much as we don't want them to sit down and be sedentary, but then they have to just do little activities that will not put pressure on their system.
So do you have a regimen of activities? Do you have certain things to move certain parts of their body, certain muscles, or is it just a general instruction?
So they should actually, there are tests that can be done to check how well one can tolerate exercise, like the 6 minutes.
Can I pause you there a little?
Okay, ma'am.
We're having a call from Kolade.
Okay,
and Kolade is calling from Ibafo. Hello.
Hello, good afternoon, ma'am.
Good afternoon. What's your question, Kolade?
I have a question. Yeah,
Go ahead.
Hypertension. I want to have, is it to have regular heartburn and maybe something like sore throat? Is this the part of saying symptoms to this?
I heard the sore throat part. What was the first one?
The first one is irregularly heartburn.
Oh, okay. Thank you very much. Thank you very much, Kolade. So he is asking, heartburn and sore throat, are they symptoms of this condition?
No, but for such a person that is having regular heartburn with sore throat, I think it needs to be evaluated for maybe having a reflux, and then because of the constant upflow, when person eats, food comes back up, and then because of that constant backflow of food, maybe what is irritating his throat. So I think you should see a specialist, try and see a gastroenterologist, who might also refer you to see an ENT surgeon.
Okay, good news for you, Kolade. That is not pulmonary hypertension, but you do need to see somebody to help the condition. If pulmonary hypertension is not addressed, it is not seen to, what are the complications?
So pulmonary hypertension is a progressive illness, And so if someone that has pulmonary hypertension doesn't get treatment, because the aim of treatment is to delay progression and help the person to be able to live, at least to live and be able to do minimum of things independently. So if it's not addressed, it's going to progress. And that means the pressure in the artery that carries blood to the lungs gets increased. And then the person can come down with symptoms like the other side of the right side of the heart might fail, and then can have things like the leg might swell up, like I told you earlier, might have swollen legs, and then can progress and then increase in size, and then might persistently have reduced oxygen supply to their body. Such people might come down with the need to have oxygen therapy even at home.
So we're having a call from Ikorodu. Hello.
Good afternoon.
What's your question?
You were talking about this thing, but
We seem to. Are you still there? The caller from Ikorodu. Okay, we seem to have lost that caller for the moment, but you can still call. We have a bit of time. You were talking about exercise regimen.
Okay.
Sorry, I forgot that I didn't go back to that.
Yes, so I said we can actually assess how someone with pulmonary hypertension can tolerate some form of exercise, and can also be used to monitor them and see if their symptoms are. So there's something like the 6 minutes walk test that can be done. So while the person is asked to move for that couple of minutes, it's going to be checked persistently to check the oxygen saturation like you were asking. So it's just to assess and see how the pulmonary hypertension is affecting such an individual's quality of life. But like I said, it's going activity level for someone with pulmonary hypertension is going to be individual based, because it's going to be tailored towards what he or she can tolerate.
So
but
when you say individually based, does that now mean that you need to have a close relationship with your patient? That means your patient cannot be far off, has to be visiting you from time to time for checkups and evaluations, right?
Exactly, ma'am.
Okay, so when a patient has pulmonary hypertension, I am aware that there are certain procedures that cannot be done. How do you handle somebody with pulmonary hypertension being sick of something else or having to have a procedure? For example, appendectomy.
Okay, so for such a person that has pulmonary hypertension that needs a procedure, especially when it's not something that is an emergency, it needs to really be evaluated. You need to check the pressure to see how we can bring down the pressure or how to maintain pressure. And then how also such a person needs to be closely monitored pre and post such procedure. But then it depends on the level of the progression of the disease of such an individual.
Okay. We're having Dr. Abu. He's in Nasarawa. Hello, doctor.
Okay, good afternoon, ma'am.
Good afternoon.
Please, thank you for your educative discussion on the pulmonary hypertension. Please, what is the prevalent rate of pulmonary hypertension?
Okay.
Yes,
I like that one because we had a battle on that one. How often, I mean, what is the prevalence, let me use the doctor's word, of pulmonary hypertension? Maybe global statistics, Nigerian statistics, whatever statistics you have. What does it look like? What's the picture?
Okay, so let's start with where we are. We're in Nigeria, we're in Africa. The data is not really that plenty. We don't have much of data, but there have been studies that have been done on different category of people that can have pulmonary hypertension. There are studies that have been done on people that have sickle cell anemia. Studies have been done on people that have heart conditions, people living with HIV and stuff. So we really don't have, but for like people that have sickle cell anemia, it's about 10% for them. Then those that have a heart condition, I saw some studies that the prevalence they got was as much as 20%. But so in all, generally, like pulmonary hypertension as a whole, statistics for pulmonary hypertension as a whole is very poor in Nigeria and even African studies. But there have been a couple of studies that have been done on those different subsets.
Okay, so I have a question from a caller, if you could handle it quickly. What is the implication of somebody with that condition getting pregnant? And can the person carry the pregnancy through?
Okay, so for someone with pulmonary hypertension, getting pregnant is not really advisable because it can make the condition to progress and cause worsening of symptoms.
So do you advise your patients not to get pregnant?
I wouldn't advise, but then it's a multidisciplinary decision.
But if you had a patient who got pregnant, who would be involved in the management? Because you can't say, oh, you need to remove this baby. You have to manage it as best you can. Who would be involved?
So if a person with pulmonary hypertension should get pregnant, such an individual will have to be managed by a multidisciplinary team, and then there will need to be a multidisciplinary approach, and then with frequent coming together of the multidisciplinary team to evaluate and know the way forward. But like I said, the tendency of disease progressing is very high.
Okay. Thank you very much for coming to the show.
This
has been a real eye-opener. Ayotunde, you're looking very healthy, if I must say so, and fine, if I say so myself. Thank you so much for being on the program with us and for your questions, wonderful questions. Kolade Inibafo, the caller in Ikorodu who didn't give her name, and Dr. Abu. Thank you so much, and for the rest of you, have a lovely day. I am Mary Alale.